All right, everyone, back to the Atlanta Dental Spa podcast. I'm sitting here still with Dr. Jason Hamilton from the Johns Creek location. And we're going to go over a pretty cool case. So stay tuned. You're going to like this one. All right, so let's do a segue and let's talk about cosmetic dentistry, right? Which is the artist touch of dentistry, right? Being able to see something and then being able to sculpt very gently the end result. People would always say to me, and I'm sure you hear this all the time, well, I've seen people who have veneers and I don't like them, right? Or I've seen people who've had work done and I don't like them. And so your answer, what is your answer to that?
If you can tell that dentistry has been done, then it hasn't been done well.
Right.
Honestly.
What do you think the dead giveaway is for people who've seen, like, I saw dentistry. What do you think they saw in that person that was the dead giveaway for it being fake?
It's what I like to call American Standard white, toilet bowl white.
Okay.
Where it looks like a piece of porcelain. It looks like, your toilet bowl.
Yeah, okay.
And the reason why a lot of these veneers look like that is because of very specific characteristics that are not included in the design of the veneer. Mm-hmm. Natural tooth structure is not one color.
So it's not one. Right. So, but here's the problem: is that our society has, through the Instagrams and the filters and all the things, people have been wanting whiter and whiter. So they're okay with. You hear people being like, "I'm okay with it being super white."
Right.
But there's a difference between chalk white versus I think you're saying like the grading of color. You can still get super white, but you got to have some variance in there. Otherwise, it looks like a sheet of paper.
Correct. You can't be monochromatic with everything.
Yeah. Okay. So I would say personally, the biggest dead giveaway too is if you ever see a set of bad veneers or dentistry that's been done poorly, or maybe through a cheap laboratory even, is if someone, you notice it from the side, and it almost looks like it's like a, I'm going to date myself with this, but Lee press-on nail, where it's just hanging off of the tooth, right? The gums may be a little inflamed, but it's just kind of sitting out from the tooth a little bit. It's bulky. Or, we've seen that where there's the line above that where people know there's metal underneath that. Obviously, that's a dead giveaway, but people say, I don't want that line. I don't want that line of there. I'm like, don't worry, you're not going to get the line.
Yeah.
That's from an old metal crown. Okay, so you think it's color. I would agree with that for sure. I also think that it could be done through, not all veneers are created equally.
Correct.
Right. So the dentist has to be artistic, but equally the ceramist has to be artistic as well. Like, it's not just send it to veneers.com and get your veneers back. Like, here's the stamp. Right. But it's not, one can't make you great. Meaning you can't have a subpar cosmetic dentist and then an excellent laboratory, right? You got to have this cohesive team that are both doing it all day, every day. Yep. I get people that come to me all the time and just in life, and they're like, hey, well, my brother-in-law's dentist is going to do it. I mean, my brother-in-law who's a dentist, he's going to do it. I'm like, that's great. How often does he do it? Well, I don't know. I think he's done them before.
Yep.
I'm like, okay. So, and I just kind of, I want people to get what they want kind of thing, but I just kind of ask questions like, would you go to, would you take your car to an auto? I mean, this is probably a bad metaphor, but everyone's going to get it. Like, would you take your car to the wrong manufacturer, right? If you had a Toyota, would you take it to a Porsche factory? It's not, you want someone that's been doing that all day, every day kind of thing. Again, that was a horrible metaphor, but you get what I'm trying to say.
Yeah.
Because I have seen, and I'm sure you have too, the horror stories of regret, right? Well, I got it for a good deal, or I didn't want to tell my general dentist that I didn't want to let him down by not doing it, even though he offered it. So many times people come in and they say, well, I'm kind of cheating on my dentist here. And you're like, that's okay. He's probably okay with that too.
Yeah. One of the great examples of that is the destination dentistry, vacation dentistry.
Yes.
You can save a lot of money on the front end, but you'll be coming back and spending it on the back end.
I think too, Dr. Hamilton, what people don't understand is that the vacation dentistry, right? And then you unpack those. So we forget that we only get one set of teeth in our life, one adult set. And so if you go to something that's been, let's just say, super aggressive, and I've seen some terrible situations, really heartbreaking things where the person had pretty decent teeth. Like, okay, okay, I see why you wanted veneers. They were decent teeth. It wasn't like a mouthful of cavities, and they've come back. And in the X-rays, they come back. They didn't like what they had, and they were in a lot of pain, right? With now root canals of things, and then you look at the X-rays and you see the whittled down teeth, right? Yep. I had a patient once call them cat teeth underneath, because that is kind of what they look like on the X-rays, and it almost brings a tear to your eye, because there's no. Yes, I know you were inspired by the beaches potentially of this destination, and they'll do the veneers for $300 each or $400 each or whatever it is. And then you see the lifetime pain that's going to come from like this person who's now 40 years old, 30 years old or whatever. They've got 40 years of management ahead of this situation.
Yep. You can never get it back.
Never get it back. Versus like, well, like a plastic surgery or something on your skin, maybe it can regrow, right? And I'm trying to draw that parallel that it's just not the same, right? Even plastic surgeries can be reversed to a certain degree. Let's say you had a botched plastic surgery, but like dentistry, once you quote unquote remove that tooth structure, it's a mess, and it's gonna be a mess for the dentist, the next dentist you see, and it's gonna be a mess for you managing going forward. You're probably never gonna be happy again, because So I always just caution people. I know we went from. Right, my brother-in-law is the dentist who will do it, and that's probably fine. Like that's probably safe. Yeah. To the extreme example of vacation dentistry, and and we'll make the standard disclaimer that I'm sure there's exceptional vacation dentistry people.
There's always exceptions,
right? And I'm sure that So I'm not throwing shade to everyone but us, but it's just like do your research, do your diligence, look for before and afters, physically talk to the people. If that's what you're going to do, like, if they're proud of their work, they'll let you talk to these people. And it's just, it's sad. I'm actually, I'm hemming and hawing right now because I'm thinking of there's 3 people that I can think of that pop up. And
to interject a little bit, the veneering process is not easy. There is nothing easy about changing somebody in this way and doing it safely and doing it in a way that it has longevity.
Right.
You've got to put your work in. First of all, you got to know what you're doing.
Right.
Second of all, you got to put your work in. It's not something you just can do super quick. You've got to over-engineer it on the front end before you even touch the patient. If you don't do that work on the front end, yourself as a dentist and with your lab, you're setting yourself up for a fall during the procedural part of it. But even worse, you're setting the patient up for a fall. A lifetime of problems, potentially. Because these veneers have to be designed a very specific way, it's not all about aesthetics, I'm sorry to say. But if these things don't function well and they're not hygienic, you're going to have a nightmare on your hands for decades.
Yep.
So you have to know what you're doing. You have to put in the time. You have to put in the work. Or you're not doing your patients a service.
So this is where I think, to my point about does that dentist do a lot of it? Because it's, even if they worked with it, let's just say they hypothetically work with an exceptional lab, they're going to make beautiful teeth. But the dentist that starts it is the architect, meaning you have to look at that patient's face. Like we're about to look at a case and you're going to kind of walk me through your deed, but you looked at her cheekbones, you looked at the way she smiled, you looked at how much clearance there, it was all these things, right? And this is before you've obviously ever done any dentistry, right? And then you're going to design it in a quote unquote architectural plan, which would be the mock up or wax up, right? And you're going to see how that works. It's like a living, breathing model. Do we love everything about it before we go to the permanence?
Yep.
And unfortunately, you hear the stories where someone goes from, I asked for veneers and this is what I got. Right, there was no feedback, there was no this, it wasn't the right color, I was sedated, or I couldn't respond, or whatever. I know we talked about sedation, but you hear these situations where I got what I got, kind of thing, and now I'm back in your chair because I blew it the first time. So I know I said a lot right there, but I think where you were going with this is the most important parts of it is the planning and design phase.
100%.
Yeah,
100%.
And then obviously there's the actual doing of, but it's not there are procedures in dentistry and medicine that are more aggressive, meaning sinus lifts and things like that. You need some brute force. the veneer part is like is less is more, right?
Yep.
I always tell people that I only want to remove, like I have veneers, and I only wanted removed as much as the minimal amount of tooth reduction that was needed to achieve the cosmetic result.
100%.
Right? Versus, again, not to throw shade, but there are dentists out there who, if you're not doing it all day, every day, you have to leave a lot of room for the ceramist because you don't really know where you're going. And then someone has to bail you out.
Yep.
And then, I didn't know, Miss Jones, you wanted this. And I didn't describe that very well to someone who's listening who may not be a dentist, but ironically, the cases that less tooth reduction is done are the hardest ones. As a matter of fact, I would say probably the hardest cases are like a no prep.
Right.
To make them look really good is like almost like a no prep veneer case. So let's talk about this case we have in front of us, and Sam, if you wouldn't mind, let's put it up on the screen so the viewers at home can talk about us. Sam is the Jamie of the Atlanta Dental Spa podcast. And so let's walk through this because you and I were talking before we recorded about how you love this from a sedation aspect as well as cosmetic.
Right.
And do that whole wind up again because I think it was really cool.
Okay. Well, this patient, wonderful person. Now that I've
we can
gotten
give her
to-
a fictitious name.
We'll call her Sue.
Sue.
Yeah,
Okay.
Sue works, right?
Sue.
Okay. So Sue came to see me.
Okay.
And it was one of the most awkward consults that I've ever experienced initially.
Okay.
And I don't, not to toot my own horn, I don't have many awkward consults, but
Well, you can connect with people. Yeah, you get it.
I appreciate that. But she said, I mean, she didn't say anything. She
Right.
basically sat there. I knew why she was there. She didn't like her two front teeth. And so I was trying to get her to talk because the whole idea behind a consultation is to engage the patient and get them to tell me why they're here. And if you don't create that dialogue initially, you're not going to get the full picture of what needs to happen to make this patient happy, make them want to smile. Because she had a very guarded smile. She wouldn't smile at all when I first started talking to her.
So this is in the consultation.
This is in the consultation. I could barely get a word out of her.
and referred from a previous patient, right? So there
A
was already that social
a previous veneer patient.
So she already had
Yeah.
that like social proof. All right, you
Yep.
got it. Let me go talk to him, and then it was still guarded. Okay.
Yep.
Was that just fear?
100%. Yeah. So I got through about 15 awkward minutes with her, very awkward minutes, and I literally couldn't get anything out of her. And I was like, all right, this is going nowhere. She obviously wants to go somewhere else or do something. And I was like, I'll just say, okay, so if you want to do this, if you decide to move forward with this, I can put you to sleep for it. You won't remember any of it. And she literally, it was like a switch went off. She like got up in the chair. She, what?
Got her attention.
And I was like, yeah. I was like, I thought that's why you were here. You knew I'm sedated, right?
Yeah.
She was like, no. And I mean, then I couldn't shut her up. She told me everything that she had, all the things she liked, didn't like, her entire experience with the crowns that she didn't like, that brought her into the office in the first place. And it's fantastic because I got more information in the last 5 minutes than I did the full 15 before. Just because she got so relaxed
hopeful,
and at
and
ease.
she got hopeful
Yeah.
that there was a solution,
Yeah.
right? All right, so her chief complaint was in this that we'll go back to this.
Yeah.
The chief complaint was she didn't like her front.
She didn't like the two front crowns that she had done. I want to say it was over 10 years prior. It's kind of the same old story. You know, she started having kids, and the kids always come first. And so she put all of her desires and wants and needs to the side. And her kids are old enough now. She was like, finally, all right, I'm going to take care of these because they've been bothering me this entire time. I'm just going to see what I can get done.
Okay.
And so we started talking once she started talking and talked about her options as far as what we could do, not only with the size and the shape of the teeth, but also the shade, the color, and the translucency, the things that make teeth look natural.
Well, where did the conversation go? She's like, all right, now you have her attention, right? And now it's like, okay, you can knock me out. And so she's still thinking two. And then how did you basically say like, hey, the issue is probably not just these two that
Right.
you're not liking your smile
Right.
with, right?
It was actually a very easy dialogue once I got her to open up, because it was like a floodgate almost, because it was almost like a domino effect. We started talking about the two front teeth. And I was like, okay, what do you not like about those? And she was saying specifically, they look big, they look like horse teeth. I don't like the shape of them. The contours are not right. And I was like, okay, well, do you see how those teeth go into the next teeth that go into the next teeth? Do you like the way, if we could change those things about those two front teeth that you don't like, are we still happy? Are you going to be happy with just changing those two teeth? And she sat there for a second. She was like, no, I don't think so. And I was like, okay, well, let's get into that. And so the whole idea behind this is not to like say, okay, let's see how many things we can do here.
Right.
It's for me to start a conversation so that you can start seeing what I see.
Right.
Because I see all sorts of different things, right? I'm not here to
push you in a direction.
I'm not here to push in a direction or to even criticize. And that's the important thing. A lot of people would think this is like, oh, you're criticizing them to death and they just want to do more because you're saying there's all this stuff wrong with it. No. I'm saying these are the things that I see. I'm perfectly happy with them if you're happy with them, but this is how we can change them.
Right. So agree. So if we look at kind of her smile right away, right? So obviously she's smiling differently in the bottom one because she's more proud of that, right? It's a bigger smile.
Right.
So I'm guessing she had orthodontics where she had extractions.
She did.
So she's missing the two bicuspids, right? Which is making, and that's a very common thing in our generation. Like you and me, I'm 50 years old growing up. Like that was a very common orthodontic practice was like, oh, we don't have room in your mouth.
Yep.
Let's just take out one of these bicuspids, right? Or premolars. And that'll give us all the room we need. So we'll just do that. And that was very common. Yep. Unfortunately, what we saw and I talked to an orthodontist about this in Atlanta. I said, I think that was like y'all's darkest time 100%. It was just like terrible, terrible dentistry advice because it closed down airways. It caused,
aesthetic issues, functional issues, everything.
Deficient corridors. And so you see these people who have wide lip smiles and then their teeth cave in.
Yep.
Right?
The black triangles.
So that's what that's called is a buccal corridor, we call it in dentistry, where you see it looks shadowed because there's so much space between the tooth and then their smile, right? The lip of it. And so by filling it out, kind of what you did, we're able to expand that corridor and it just fills everything up. So
you got to look at the framework of the lips. That's what's going to frame all of this. And that was one of the things I brought up to her. I was like, you see the dark space here. Everybody comes in wanting a bigger, broader, more beautiful smile.
Right.
The broader is something that people don't really understand what's involved with that. But filling in spaces in the back of the mouth is just as important as filling in spaces in the front of the mouth in that regard.
Oh, you mean in the back of the visual portion?
Correct.
Yeah, 100%.
Correct.
You almost would say, I mean, there's kind of a rule in dentistry, and unfortunately you see this kind of in cosmetic dentistry, that 6 teeth is probably like the no man's land of where you want to do, and you see, and I always say that it's the transitional tooth, meaning between the front of your mouth, which is the 4 front teeth are kind of in your front, and then it transitions as you go backwards to your mouth. And if you stop on that transition, it can look very like one plane. Yep. And so it's almost like do 2, 4, 8, or 10 on your uppers, right? But don't do 6 because it's really hard. It can look very artificial.
That canine is where everything splits.
Yes.
And that's where the shadows at the back of the mouth start.
Right.
So so the back teeth, they look darker anyway. So if you want to brighten up those front teeth, it'll make them even more dark and more obvious. So it's like a beacon of light that you just had your front 6 teeth worked on.
And then you have this narrow arch, and then you've got shadowing coming in. And so that is, going back to how we started this, I've seen bad dentists, I've seen veneers, and I don't want to do that, right? And it's more than likely that, like we said, either the poor ceramics, the bulbous nature of it being kind of potentially cheap ceramics, or inadequately designed for the patient's mouth. Meaning we talked about the buccal corridor. So it's not just, it's the color. It's the lab. It's this. It's, there's probably 5 factors of where you can be like, I see the bad dentistry. And if someone doesn't do it all day, every day with the scope of all the things you've just said, then potentially you could be oh, nice veneers. And no one wants to hear, hey, did you just get veneers? Nice veneers. You want to hear,
Yep.
did you lose weight? Did you
Yeah.
get new hair?
Yeah.
Doing something different? Right? Your
look
smile's
good.
great.
Yeah.
Did you whiten your teeth? Did you whiten your teeth?
Yep.
Right? And that's the best case when you hear someone who had like, you just did 20 veneers on them and people are like, all they asked me is if I've whitened my teeth.
I know.
And like, well, guess what? The answer is yes.
Yep. That's the goal. That's always the goal.
And that is the goal, right?
Yeah.
Because you can't put your finger on what it is,
Right.
but it looks really good,
Yep.
right? So versus the like you said, the beacon of light, someone coming in and being like, it's like Ross from Friends. Remember that episode?
100%. Yeah.
Right? And it was a dead giveaway that Ross had Ross from Friends, or I'm back from my we see this on Instagram all the time. These videos of people like, I'm back from my overseas dental trip, and then you look in the comments and it's just people being like, I read the comments, all that stuff.
Yeah,
I think it's funny. What else was your favorite? Obviously, she got excited about the sedation. How did you manage in this scenario where you needed her involved in the decision-making process, right? Because I alluded to the fact that some people in the past have like, I got what I got kind of thing.
Yeah.
So how did you keep her sedated and not being fearful of the process, but also engaging her in the outcome?
Right. A lot of that has to do with what we were talking about before, the pre-planning. Okay. So my patients are in control as much as they can be. I'm here for the functionality and the hygiene of it all. I'm going to make sure that's okay, because whatever I put in there is going to have to be just as easy or easier to take care of than what you have coming in.
Okay.
I'm not going to make things more challenging to take care of. That's never going to be the case. So within the limitations of the anatomy, within the limitations of functionality and hygiene, the patients, I give them control over it, to be totally honest with you, as far as the design goes. And some people know what they want, some people don't. And a lot of times, some people think they know what they want. And they don't really know what they want until they see it. So I'm there to kind of help guide, but I want everything they have in their mind's eye, what they identify as themselves, and what they're saying, okay, this is going to make me my best self and make me come out of my shell, so to speak. I want to make sure that I get as close to that as I possibly can. Now, the cool thing about this is that after the procedure is done, and we just skipped over a huge portion of this whole process, the patient is in temporaries. And the temporaries are based off of the wax up design, the blueprint that we've created through my discussions with my patients, my discussions with my lab, as far as what we think we want, okay? So once the patient usually wakes up after that procedure, they will have a mock-up of the new smile in their mouths in temporary form, okay? So people are like, okay, well, what next? I mean, you just get the lab to go ahead and make it. No, the lab doesn't get to make anything until you give it a trial run.
Right.
There's at least a week, if not 2 weeks. It doesn't matter how long it is, to be totally honest with you, where you have to wear these temporaries and make sure that they are you. I'll make sure from a functionality standpoint, the bite works, everything works from a hygiene standpoint, but you've got to make sure as a patient, as my patient, that they fit who you are. They fit your personality. I don't want you looking in the mirror every morning and being distracted. I want you to smile at yourself or brush your teeth or whatever you're doing in the mirror, and I don't want you looking at one area and saying, okay, that drives me nuts. I want you to see yourself and say, man, that looks
So the
good.
process is a little bit different, meaning it's a little bit more, because at Atlanta Dental Spa, we do this a lot. Like, just to be frank, I mean, everyone has known us for that in Atlanta. So the process is a little bit different in that you're saying it's the consultation, but then it goes to the architecture plan. So it's like, here's your wax up, here's your modeling, here's what we're going to do. Maybe we transfer that in before we ever do anything. Sometimes we look at things. Okay, then the next phase is you're in the preparation point where there's general contouring of the teeth in order to accommodate the goal, right? And then they wake up, in this instance from sedation, then they have chance number 2 to talk about what they like and don't like, right?
Yep.
And then, like you said, they have to kind of be in a living model of that, right? Play around with it when you're not numb. Do you like the way things look? Do you want to round this? You want to, how's your bite feel? How things moving? How's your speech? Things like that.
Phonetics are important.
Right.
S&S has got to work.
Phonetics are really, You don't want to get a new lisp.
Right.
That's for sure.
Exactly.
And we've seen that.
Yeah.
So, this is one of those things. I think where you're going with this is you mentioned in sedation that you can be very efficient, right, with getting a lot of work done in the back. In a cosmetic thing, in a cosmetic situation, it's probably, you don't want to be as efficient as possible. Just do it and put it in and be there, because it's so vitally important to all the things.
Everything has got to be very precise.
Right.
Yeah.
So there's a tested, you have a tested blueprint about how to get outcomes like this.
It's all about quality control.
Right.
Yeah.
Right.
You can't move from phase 1 to phase 2 unless phase 1 is perfect.
Right.
There's no reason you're going to set yourself up for failure otherwise.
So I'm just curious, when you were all done with her teeth, and you've seen her subsequent times, I'm guessing since then, I don't know how long ago you did this, but
yeah,
like, what has she said?
She's a completely different person from the person that I first met. I mean, enjoys coming to the dentist.
Yeah.
Like, not scared at all.
The
like,
fear's
she
gone.
literally is. I can hear her when she walks in the door.
No
kind
way.
Of thing. Yeah, completely different person. I mean, different person from I knew her, because I think this is who she is.
Right.
But
a different person than you got the first consultation.
Correct.
Yeah, you got the real version.
And I like her real version. It's pretty awesome. Yeah, it's great. I'm just glad that we could help her get to the point where she felt comfortable, I think, in just about any situation, any scenario, smiling for pictures real big, just that involuntary laugh that you have when somebody tickles you or tells you a joke. She's not guarding her smile anymore. It is out there for everybody to see.
I love it.
Yeah.
I love it. Is this, where would this rank on one of your, obviously you've done so many transformative things, and I've seen over the years, where would this rank for you in terms of, it's really hard to quantify it, but
it is. Because there's so many different factors to that.
So many factors.
She's a beautiful person already, but this is a beautiful smile. Mm-hmm. But more importantly, what we were talking about before, the result of who she is now, when I see her, is just, you cannot.
Well, look, and we're all fighting against Father Time, right? And so this is, I always say to people considering dentistry or facelifts or things like that, I'm like, do your teeth first, because it's a very easy, versus these draconian measures. I'm going to go get all this filler, this and a facelift and this pulled and this.
Talking about not reversible.
Well, I think that but it's the best option. And for whatever reason, sometimes people skip over it, oh, teeth are teeth. I'm like, well, it's really the most noticed facial feature, and this is a scientific data point. It's more important to human perception of beauty than your eyes.
100%.
Right. And it's as we all know, the smile is like the universal language. You go overseas, don't speak a thing of their native language, but if you smile, let them, everyone knows, okay, friendly, like you, right? So it's it's the only common gesture that we all have. And I see this happening with, men of my age even, right? Did you see my new watch? Did you see my new sports car?
Nope.
I'm like, nope, but I saw your broken down, grinded teeth of 30 years, and I know what you're trying to do. If you're trying to look younger, just do your teeth.
Fix it. Yep.
Okay. Sam, I think that is a wrap.
Excellent.